Unofficial COVID-19 data released earlier this week is painting a horrifying picture of just how badly hit certain neighborhoods here in Toronto are, including the one I'm in this evening here in North Etobicoke, with higher rates of positive cases in this neighborhood. But with more people testing positive, advocates and experts are asking, why doesn't the government have targeted responses? Toronto doctor Dr. Kashif Pirzada tweeted out unreleased provincial COVID-19 data that showed Toronto's northwest neighborhoods hit hardest by this virus are seeing disproportionate positive cases.
But in some of these communities, it's 5% or even over 10%. And that's a danger zone.
These are marginalized neighborhoods made up of low-income and racialized communities who already bore the worst of the first wave.
COVID-19, what it did is it highlighted some of the structural inequities that existed in these communities. So, for example, precarious employment, lack of sick leave, language barriers, unsustainable housing.
And the concern isn't just in northwest Toronto, but pockets throughout the city, which is why there are calls to collect hotspot data like the one leaked by the doctor to inform public health response.
As a health geographer, I look to those data to tell where investment needs to happen. And the fact that we haven't done this, despite what we learned about the release of race-based data earlier in the pandemic, there's not much more explanation for that beyond structural racism and exclusion.
The Alliance for Healthier Communities has been asking governments to act and develop community models to control outbreaks, asking for a 3R approach in addition to collecting hotspot data, reduce contacts with more restrictions in place for businesses and better communication, resources, forget the one-size-fits-all, and instead provide support to the community health centers on the ground.
We need to take locally based, creative, and adaptive approaches that really reach people that those one-size-fits-all approaches cannot reach. This is the only way to do it.
We asked the province today about the alarming rates in these neighborhoods.
But it's an area that we have to target, and that's what we're going to do.
The health minister said that the government is paying attention to these neighborhoods and providing that extra help.
Well, we are targeting our resources to several neighborhoods that are particularly vulnerable, where there may be a number of generations living in the same household. And so it's very difficult for people to isolate if they have symptoms of COVID.
But if you ask those living and working in the neighborhoods, that help is nowhere to be seen. Community health centers say they're relying on donations and funding from the city and United Way.
We do not have the adequate supports to ensure that these communities are protected.
The health minister adding that hospitals are reaching out to offer assistance, but advocates want to have targeted outreach measures available in hotspot communities, including flexible mobile testing units. Testing, for instance, hasn't been accessible in Rexdale.
Institutional-based testing, which is the testing at the assessment center at the hospital, is a drive-through. It's 2 buses away from majority of residents of North Etobicoke, which is in itself is a barrier. That's a drive-through. Many people in Rexdale do not have access to cars.
Now, you heard right there, one of the asks was for the province to collect this data from hotspot areas like where we are here this evening. We asked the province if it has any plans to do that. We did not receive any responses. They do, however, tell us that when it comes to race-based data collection, they are working with community groups as well as experts to look at this data, and they say they will be releasing the findings. We just don't have a date for that just yet.